Have you ever wondered why your doctor insists on the same medical tests year after year, even when you feel perfectly fine? What if I told you that a groundbreaking study in the Journal of the American Medical Association found that some routine tests after age 70 increase your risk of serious complications by 35%? In this video, we'll uncover 5 medical tests that could harm your health, independence, and even your lifespan. We'll share real stories, expert insights, and practical tips to take control of your health. If this resonates, give us a thumbs up, share with a friend, and hit that subscribe button to join Ageless Living for more life-changing advice. The hidden dangers of routine medical tests. Welcome to Ageless Living, where we empower you to live your best life, no matter your age. Today, we're diving into a topic that could literally save your life, or the life of someone you love. As we age, we're told to trust the medical system to keep us healthy. But what happens when the very system designed to protect us becomes a threat? For those over 70, routine medical tests, those annual checkups and screenings we've been conditioned to accept, can sometimes do more harm than good. This isn't about scaring you. It's about arming you with knowledge to make smarter, safer health decisions. A study published in the Journal of the American Medical Association revealed a shocking truth. Older adults undergoing certain routine medical tests face a 35% higher risk of serious complications compared to those who skip them. These aren't isolated cases. Millions of seniors are affected every year. I'm Dr. James Mitchell, a physician with over 30 years of experience, and I've witnessed a troubling phenomenon. The medical system, built to safeguard your health, can sometimes spiral into what I call the medical cascade. One test leads to another, then another, until you're trapped in a cycle of stress, procedures, and hospital visits that rob you of your golden years. In this video, we'll explore 5 specific medical tests that could silently undermine your health after age 70. We'll share real-life stories, like Margaret's, a vibrant 78-year-old whose routine checkup led to a devastating outcome. We'll break down the science, uncover hidden risks, and give you practical tools to navigate the medical system with confidence. Ready to take control of your health? Let's dive in. The medical cascade, a silent threat. Picture this: you're a healthy, active 75-year-old. You garden, play with your grandkids, and enjoy morning walks. Your doctor, with the best intentions, recommends a routine test, just to be safe. 6 months later, you're weaker, stressed, and shuttling between hospital visits. What went wrong? This is the medical cascade, a chain reaction where one unnecessary test triggers a domino effect of more tests, procedures, and treatments. It's not about your health anymore. It's about the system following protocols designed decades ago, when life expectancy was shorter and our understanding of aging was limited. The most dangerous phrase in modern medicine: just to be safe. These 4 words have sent countless seniors on medical odysseys that strip away their independence, peace of mind, and vitality. The truth is, your body at 70 has different needs, risks, and priorities than it did at 50. Protocols that once protected you may now pose serious risks. Let's explore the 5 tests that could be doing more harm than good. Test number 1. The colonoscopy trap. Let's start with one of the most common tests, the colonoscopy. For decades, it's been hailed as the gold standard for preventing colorectal cancer. But here's what your doctor might not tell you. After age 75, the risks of a colonoscopy often outweigh the benefits. Why? Let's break it down. Imagine Robert, a 76-year-old retired teacher. He was active, independent, and symptom-free, with 2 normal colonoscopies in his past. His doctor insisted on another routine colonoscopy. During the preparation phase, drinking powerful laxatives to clear his system, Robert became severely dehydrated. His electrolyte balance went haywire, and at 3 a.m., he fell in his bathroom, fracturing his hip. That fall changed everything. 3 months in rehabilitation, a loss of independence, and now Robert lives in a nursing home, all because of a test he didn't need. The preparation for a colonoscopy is grueling, especially for older adults. Those strong laxatives can cause dangerous dehydration, particularly if you're on blood pressure medications or have kidney issues. Your body doesn't bounce back like it used to. Then there's the sedation. Anesthesia affects older brains differently, sometimes causing confusion, disorientation, or even postoperative cognitive dysfunction, a condition where mental clarity never fully returns. Is it worth risking your mental sharpness to find a polyp that might never cause problems? Here's the science. It typically takes 10 to 15 years for a small polyp to develop into colorectal cancer. If you're 78 and have had normal screenings, what's the real chance a polyp found today will impact your quality of life? Almost zero. Yet, the procedure itself carries immediate risks: dehydration, falls, sedation complications, and even bowel perforation. The American College of Physicians advises against routine colonoscopies for adults over 75, yet many doctors continue prescribing them out of habit, fear of malpractice, or outdated guidelines. So, what's the smarter approach? Listen to your body. If you notice blood in your stool, unexplained weight loss, or persistent abdominal pain, see a doctor immediately. But if you're feeling great and your past screenings were normal, have an honest conversation with your doctor about whether this test is truly necessary. Ask, what are the risks? What happens if we find something? What if we skip this test? Knowledge is power. Test number 2. The full body scanner, an anxiety machine. Next up is the full body CT or MRI scan, often marketed as a cutting-edge way to see inside your body and catch problems early. Sounds appealing, right? Who wouldn't want a machine to spot issues before they become serious? But here's the catch. These scans can be a Pandora's box, especially after 70. Full body scans detect everything, every tiny spot, nodule, or irregularity, even those that have been there for decades and pose no threat. That speck on your kidney, it's been there for 20 years, harmless. That small lung nodule, it might disappear on its own. That liver irregularity, likely benign. But once a scan flags these as abnormal, the medical system can't ignore them. You're suddenly on a conveyor belt of follow-up tests, specialist visits, and invasive procedures. Take Patricia, a curious 73-year-old who decided to get a full-body scan at a health fair. The results showed a suspicious lesion on her kidney. Within 2 weeks, she was scheduled for a biopsy. During the procedure, she suffered a collapsed lung, a known but devastating complication. Patricia spent a week in the ICU, months recovering, and developed chronic fatigue that never went away. The lesion, harmless scar tissue. She traded her vibrant health for information that meant nothing. There's another hidden danger: radiation. While a single CT scan seems harmless, the cumulative effect of multiple scans over your lifetime can actually increase your cancer risk. Ironic, isn't it? A test meant to prevent cancer could contribute to it. But the psychological toll might be the worst. Once you know about that spot or shadow, you can't unknow it. You worry, lose sleep, and fixate on something that likely means nothing but feels enormous. The smarter move: avoid full body scans unless you have specific symptoms warranting investigation. If your doctor suggests one, ask, what are we looking for? How will this change my treatment? What are the risks? Protect your peace of mind and your health. Test number 3. The heart stress test, treadmill trouble. Your heart has been beating for over 7 decades, carrying you through life's joys and challenges. So when your doctor suggests a stress test, just to check, it sounds reasonable. But for many seniors, this test is like using a sledgehammer to hang a picture frame, overkill with serious risks. Stress tests were designed to detect heart issues in younger people with symptoms like chest pain or shortness of breath. But as we age, our hearts naturally change. Arteries stiffen, electrical patterns shift, and recovery times slow. These aren't diseases, they're normal signs of a heart that's been working hard for decades. The problem? Stress tests don't account for this. They often flag these natural changes as abnormal, leading to false positives that spiral into invasive procedures. Consider George, a 74-year-old who felt great. No chest pain, no shortness of breath, just energy for his morning walks. His doctor ordered a routine stress test, which showed irregularities. Not because George was sick, but because his 74-year-old heart didn't perform like a 35-year-old's. 3 weeks later, he underwent a cardiac catheterization. The procedure found mild, age-appropriate plaque, but the cardiologist inserted a stent just to be safe. During the procedure, George developed a severe infection at the insertion site. For 6 months, he battled complications, lost weight, and never regained his vitality. Studies, including those from the American Heart Association, now caution against routine stress tests in symptom-free seniors. These tests don't extend life or prevent heart attacks in this group, they just create new problems. If you're feeling well, ask your doctor, why do we need this test? What will it change? Prioritize your heart's real-world performance over a treadmill's verdict. Test number 4, bone density scans, fueling fracture fears. Osteoporosis is a real concern, and fractures can be devastating for seniors. But routine bone density scans, often pushed on older adults, can sometimes cause more fear than protection. Here's why. Bone density standards were set based on data from young, healthy women, not accounting for the natural bone changes that come with aging. So, a normal age-related decline in bone density is often labeled as a disease requiring immediate treatment. This leads to prescriptions for bisphosphonates, drugs like Fosamax or Boniva, that can cause severe side effects in older adults, like jawbone death, unusual fractures, or digestive issues. Then there's the psychological impact. Imagine Dorothy, who swam, walked, and gardened without issue. After a bone density scan diagnosed severe osteoporosis, she became terrified of falling. She stopped her activities, started bisphosphonates, and developed acid reflux and muscle pain. Within a year, she was frail and anxious, not because of her bones, but because of fear. The diagnosis created the very problem it was meant to prevent. If you've never had a fracture and feel strong, question the need for routine bone density scans. Focus on staying active, eating well, and building strength to prevent falls. Ask your doctor, how will this test change my lifestyle? What are the risks of treatment? Your mobility matters more than a number on a scan. Test number 5. Routine cancer screenings after 75. This one's controversial, but it's critical to address. Routine cancer screenings, like mammograms, PSA tests, or cervical cancer screenings, can do more harm than good after age 75. Why? Most cancers in older adults grow slowly and may never cause symptoms or affect quality of life. Yet, their detection triggers aggressive treatments that can devastate an aging body. Take mammograms. The radiation adds up over time, and some experts believe decades of routine screenings may actually increase breast cancer risk in older women. Plus, mammograms often detect ductal carcinoma in situ, CIS, abnormal cells that may never become invasive cancer but are treated as aggressively as true cancers. Eleanor, 78, had mammograms for 30 years. Her last one flagged CIS, leading to surgery, radiation, and hormone therapy. The treatments left her weak, exhausted, and depressed. She often wonders if she'd have been better off never knowing about cells that might never have caused harm. The key question, at 75, is it worth enduring treatments that impact your quality of life to prevent a cancer that might never happen? The U.S. Preventive Services Task Force suggests stopping routine screenings after 75, yet many doctors continue them. If you're symptom-free, discuss the risks and benefits with your doctor. Focus on living well today, not chasing what-ifs. A new approach to health after 70. So, what's the alternative? It's not about neglecting your health, it's about embracing medical wisdom. After 70, shift your focus from preventing disease to preserving quality of life. Here's how. Listen to your body. Only pursue tests for clear symptoms like persistent pain, weight loss, or unusual changes. Your body's signals are more reliable than a machine's. Ask the right questions. Before agreeing to any test, ask, will this improve my health or function? What are the risks? What happens if we don't do it? Demand clear answers. Embrace normal aging. Your 75-year-old body isn't meant to function like a 25-year-old's. Some changes, like stiffer arteries or lower bone density, are normal and don't always need fixing. Prioritize quality over quantity. Would you rather live 2 vibrant, independent years or 10 years weakened by hospital visits? Choose treatments that enhance your life, not just extend it. Focus on what matters. Instead of routine tests, assess what keeps you independent. Functional tests. Can you climb stairs without getting winded? Stand from a chair without using your arms? Balance on one leg for 10 seconds? These predict your future independence better than any blood test. Cognitive health. Can you manage your finances, remember appointments, or hold engaging conversations? Mental sharpness is your greatest asset. Social connections. Do you have people to call for help? Are you engaged in your community? Loneliness is deadlier than most diseases. Symptom monitoring. Are you comfortable most of the time? Do you sleep well? Have energy for what you love? These matter more than your cholesterol levels. Medication review. Are your medications causing dizziness, confusion, or weakness? Over-medication is a common issue for seniors. Create a personal health philosophy. Define your principles. Prioritize quality over quantity, symptoms over test results, function over findings, and wisdom over fear. Live in the present, not in fear of what might happen. Real stories, real wisdom. Let's meet Sarah, an 82-year-old who decided to stop routine screenings after watching friends suffer from unnecessary procedures. Instead, she focused on eating well, staying active, nurturing friendships, and pursuing hobbies. Sarah lived independently until 94, passing peacefully in her sleep, not surrounded by hospital machines. Her story proves that health is about living in alignment with your values, not chasing test results. Taking back control. The medical system is designed to find and fix problems, but at 70, not every problem needs fixing. You have the right to say no, to ask questions, to prioritize your comfort and independence. Start different conversations with your healthcare providers. Instead of, what tests should I do? Ask, what symptoms should I watch for? Instead of, am I healthy based on this test? Ask, am I healthy based on how I feel? You've earned the wisdom of 7 decades. Use it. Trust your instincts. Honor your values. Your health, your choice. Thank you for joining us on this eye-opening journey at Ageless Living. We've uncovered the hidden risks of routine medical tests after 70 and shared practical tools to take charge of your health. Which test surprised you the most? Have you or a loved one faced the medical cascade? Share your stories in the comments below. Your experiences can help others make better choices. If this video opened your eyes to a smarter approach to aging, give it a thumbs up, share it with someone who needs to hear this, and hit that subscribe button with the bell icon to never miss our weekly tips for thriving in your golden years. At Ageless Living, we're here to empower you to live boldly, wisely, and vibrantly. Let's keep the conversation going. See you in the next video.